Hello, and welcome to the Qredible Summer Broadcast Series. As always, I'm here with our CEO and Chairman, Brian Fitzpatrick, and we are very excited to be joined by Kim Stuck. Kim is the CEO of Allay Consulting. She was the very first guest on our live show, and she's back today to talk about regulatory changes in the cannabis and hemp industry. We're very excited to have you on the show again today, Kim. To get us started, could you tell us a bit about your background and the work that you're doing?
Yeah, thank you so much for having me again. It's been really fun doing your shows. So I started in the industry back in 2014, and I started as a regulator, just like you said. So I actually worked for DDPHE as their cannabis specialist for a little over 3 years. And in that time, it was kind of a crash course because I didn't know everything about cannabis at that point, right? I was kind of just thinking that it was just flower. And then, all these other products started coming out and all these different processes. And we found, all kinds of issues with cross-contamination and heavy metals and pesticides and all of that. So over those 3.5 years, I gained a lot of insight and went into thousands of facilities, which was really great. Since then, I started my company in 2017. And so, I've been helping companies become compliant with regulations ever since. So we deal with state regulations, obviously. I feel like you kind of have to delve in that if you're going to be a compliance person. But what we really focus on is helping companies become compliant with federal regulations, because eventually it's going to be federally legal. As we all know, no matter what, someday it's going to happen. And so the FDA and OSHA are really what we are concerning ourselves with these days. So we've been in business for a while. We work in all 50 states and even out of country. Have been loving every minute of it. So it's been a really great journey.
I always like to say that Kim can help allay your fears of compliance and requirements, right? Like I always do that with Qredible, so we'll do it with your name as well, right?
I love it.
So that's great. There's been so much going on since the last time we talked, Kim. It's been such a dynamic environment, which is what I think really keeps everybody's blood pumping in this industry, because every day is absolutely is a new day. And, we're covering primarily two major changes in federal regulation, rescheduling and the hemp bill. We'll sort of talk about the rescheduling first. And before I ask your opinion on, what's going on there, I guess the latest is that, we're in this, the proposal calls for an open public comment. So going back to, I guess it was May 21, something like that, is when the department, the DOJ published a notice on this proposed rulemaking and their intention to move marijuana from Schedule 1 to Schedule 3. Mm-hmm. So now, as part of that process, we're in the public comment period, I guess until the couple days from now, 22nd, I think it is, which is allowing interested parties to sort of provide feedback on the proposed rescheduling. So we should be hearing something hopefully next week as we get through that public comment period. But what I wanted to do is sort of talk a little bit about what we've heard some of our guests say on the pluses and minuses. And, on the plus side, we've heard, and you can even read a lot about people saying expanded research opportunities. It would sort of streamline the research and put things into the middle of the fairway that would allow scientists greater access to get clinical studies going and get those things funded, which will, it's more like, instead of could, it will lead to a deeper understanding of things like therapeutic properties and medical applications and those types of things. So the whole safety side of it. And then, of course, everybody's been talking about the economic benefits, that it would have. When we talk about it could stimulate growth within legal cannabis, by spurring some of the states to sort of get on board a little bit faster on the adult use side. And then also remove some of the barriers and stigma. So even in the states where it is legal, people say, well, look, it's sitting next to Tylenol now. So, people who have been kind of curious, but sitting on the side, they won't feel so bad if their car's parked outside a dispensary and the fellow churchgoers or neighbors see them there, right? So, and then, of course, the big talk has always been about 280E. on the tax deduction for business, that they would no longer prohibit certain tax credits and deductions, and could result in a 70 to 90% increase to the bottom line, which, by the way, is also spurring some investor growth, because I've been following that very closely. They exited stage left, and now we're starting to see, well, they might be coming back or will be coming back. It's starting to ease up concerns from the investor and the capital market side. And then the acknowledgement of the medical use.
Mm-hmm.
So the rescheduling to 3 would officially recognize marijuana's medical use at the federal level, which would align better with widespread consumption and lower risks. And then eased restrictions on clinical research, which, it'll open up the research door, but would face less onerous registration requirements and flexibility. So those are all the pluses. But then, I've seen so much debate on this in LinkedIn. It's kind of crazy to follow. And you've got every ends of the spectrum talking about the minuses. So rescheduling, one of them would be that rescheduling would not fully legalize cannabis, right? So, some people say, oh, good, it's going to be federally legal. No, that's not going to happen. It would remain subject to significant regulation by the DEA and the FDA and state licensed, marijuana businesses. And so, the fear is that potential FDA enforcement then, who have historically taken a hands-off approach, some people are seeing that as bad. We see it in food safety and those kind of things is not a bad thing. We need guardrails, right? But some people are saying, well, that's going to make the world very difficult from a regulatory oversight side. And that was really one of the other minuses we've heard about. And then there's this fear of big pharma. Everybody's afraid that the pharmaceutical industry is going to break down the doors, and their increased involvement will sort of minimize the impact of and really the presence of all the other companies out there. So big concern about that. And then there's always, when something is federally legal, there's always the conflict with state laws. So how would rescheduling, it won't automatically harmonize federal and state drug laws, but we're not looking at something that's going to be federally legal, and I don't think we have to worry about that until it becomes federally legal, but it could potentially undermine or create a difficult legal uncertainties for state regulation. So while rescheduling cannabis to Schedule 3 would represent a significant shift in sort of the federal drug policy and the review of it, it would bring both opportunities and arguably challenges for the cannabis industry, researchers, and consumers. So having said all that, and that's a quick summation of everything we've heard, what are your thoughts about of how this is going to be good or bad for the industry?
I don't know that good or bad is really the way to look at it, unfortunately. I mean, nothing is black and white, right?
Yes.
There are some cannabis company owners that have been preparing for this and are like, yes, we're ready. We can compete with other people. We are prepared for federal legalization. We are compliant with federal regulations. Bring it on, right? And there are some who are, kind of in the realm of, hey, we aren't ready for this. We don't want to do this. We don't want more regulation, right? And the cannabis industry is really interesting because people come to me all the time and they say, we're the most regulated, we're the most regulated industry in the world. And I'm like, no, you're not even close. You have, in most states, one set of regulations you have to follow, and in other industries, not only do they have to follow, the Department of Revenue regulations, but also they have to follow health department regulations. And in most states, the health department is not involved with cannabis at all. And so that's another set of regulations that they're not regulated by. And then the other, other companies like wholesale food manufacturing are also regulated by the FDA and OSHA. So when they say like, oh my gosh, we're so regulated, I don't know what we're going to do. We don't need more regulation. It's over regulation. It's not. It's exactly what every other company in the world has to deal with if you're making a consumable product for the masses. And so, there are a lot of companies that have seen the writing on the wall. They know what's going to happen. They know that they need to be compliant with some set of regulations, even though the FDA hasn't decided what set of regulations that would be, especially like in the hemp industry. They're, rewriting stuff or trying to figure the stuff out, or leaning on, companies like ASTM for those regulations. And we'll see what happens with that. That's a whole other, story. But, being prepared is the best thing that you can do. Right. And so it kind of depends. Some people see it as a really good thing. Some people see it as a really bad thing because they don't want to be regulated more. But the problem is that no matter what, it's going to happen. If it's next year or in 10 years, it's going to happen no matter what. And being compliant with FDA and OSHA regulations it's risk mitigating anyway. And it's just good to know that you're making clean products that have good quality assurance and that you're protecting your workers, right? So it kind of is a good thing from that standpoint.
Yeah, I love that. I love that perspective because, what you said is so important. It's not a good or a bad thing, but it is the right thing to do to be prepared and be safe and have quality products.
Yeah.
I mean, that is the right thing to do. And I think you also talked about that, there's already companies that they've been preparing, they've been prepping for these changes. They've been watching and they're saying, hey, we need to live as if we're more highly regulated because that's what we have to do to stay in business and be safe. And I think that it's going to be a rude awakening for those businesses that are not getting prepared. They're going to, and I don't think, quite frankly, and we saw this happen in Canada, where companies just went out of business, when the rules changed. So I agree with you.
Most likely what is going to happen. Unfortunately, that's the world we live in. But I mean, I've had this company for 7 years and most of what we offer has not been required. And we're still in business, right? So there are enough companies out there that are seeing this and preparing to keep our consulting firm in business. So I feel like, the more companies that we can help, the more people we can get into and the more people we can prepare for this, the less it will affect the entire industry. What I am looking forward to is the relief on the industry when it comes to banking and 280E and all of, that money that they haven't been able to access that every other business is able to access, right? They'll be able to access that capital, whereas opens it up to investors. And so it's once again normalizing the industry, right? We're putting more and more cannabis companies are going to be able to access all these things, be able to write things off, and then because of that, they also have to follow federal regulation, right? So it's kind of a payoff. It's like, okay, if you want to play in the world where you're considered a normal business and treated like everybody else, you actually have to be treated like everybody else, right?
Yeah, and we've
regulated the same way as well.
And speaking of the banking side, I mean, we got to have Steve Shane back on because I actually spoke with Steve at. He and I spoke at a conference out in Pennsylvania together, and when asked about the banking side and the implications on this whole reschedule, I think he used the word nothing burger. So I want to get his, and he's such an entertaining guy. He's so smart about the industry, and I love hearing the pluses and minuses from smart people. I mean, I think it's going to definitely have an impact on the capital market side because, I mean, that it's huge. I mean, the difference that this 280E is going to have, and I'm in direct contact, by the way, with many investors that are actively right now seeking to put money into the industry. So, and I'm seeing that really build up, but the economics have changed. So that's a whole nother episode that we'll be talking about because the amount of money that was being pumped into these firms, even opening a dispensary, and the cost of a license back then and how it is now, the economics are very different. Let's switch gears a little bit and talk about the hemp bill because the before we do, I just want to acknowledge that, we're seeing these FDA warning letters increase in veracity. And I think it has to do a lot with the loophole, that exists in the current federal farm bill that everybody's operating under. But just the other day, the FDA, it was actually yesterday, July 18, the FDA sent warning letters to 15 companies for illegally marketing CBD products in a way that violate the Federal Food, Drug, and Cosmetic Act. And, and to see what's sort of happening there, it's crazy. I mean, first of all, they're illegal sale of copycat food products that are containing Delta 8,
Which is illegal for every other industry as well, right? You
It
can't
is.
make fake Skittles and sell them as Skittles or brand them in the same way, right?
Yeah, especially if you're putting stuff in like that's appealing to children, like a Delta 8 would knock a little kid on his
Right.
rear, and
Especially
probably some adults.
intoxicating things. Yeah, you couldn't, market alcohol that way, right? You couldn't make a Butterfinger,
Uh,
whiskey and then, not be a part of Butterfinger or, market to children.
Yeah,
Um,
absolutely. I mean, that's so concerning, and these packaging concerns, and even, I mean, so it's not only it's appealing to children, where accidental ingestion is increasing. I mean, we're seeing, and even unsuspecting adults,
mhm,
for goodness sake, and we're seeing calls to the poison control, hotline increase. And then, they're also getting, they've hit some of these companies on unapproved, where new drugs is any product that's claiming to diagnose, so these new
yeah,
things that are coming out, that it's going to cure, it's going to treat, it's going to prevent, all of that, what I call the naughty language, that cannot be used, which our technology quickly finds through our bots and helps
mhm,
companies to stay in compliant and compliance. But and then the fact that there that these unlawful use in food and dietary supplements, that the FDA has asserted that Delta 8 THC and CBD cannot be legally sold as a dietary supplement. So, we also sort of work in the dietary supplement space, and
mhm,
it's just, I mean, it's concerning, when you see this stuff happening. So it sort of leads to, what there's a lot of bad things that can happen to these brands, including legal action that,
mhm.
the government can take. And you were talking about, you can get sued by Skittles, right?
Yeah, oh yeah.
And then, the ongoing monitoring that, you're going to be under a close microscope, which is going to lead to future inspections. It's going to hurt your reputation. It's going to increase your compliance cost.
Mhm,
And I mean, in the future, as these companies, as it starts to become more in the mainstream, like CBD in particular, that how do you become recognized as, as safe, right? Generally recognized as safe for human use, as we see those things start to play more closer to the food industry as we evolve a little bit. It's like you'll have no chance, you'll have no hope. So
yeah.
it's just crazy, and it leads to some of the things going on in the hemp bill. So we do know that, um, I guess we don't really have a current hemp bill yet, or a farm
Not
bill. So
yet.
what
Yeah,
what's
so
your
it's
what's your
it's
thoughts
open
there?
comment right now. So we'll see. There's a lot of people putting in comments, which that's what you got to do, right? As an industry, we need to come together and have our voices heard. There, it's open comment for a reason, and we only have a few days left. So everybody, do it, please. Yeah, I mean, we're not really sure what is going to happen and how they're going to change things, but the way that it's written in the draft right now, essentially those cannabinoids that are intoxicating are going to be treated completely different, right? And essentially, they've made it so they're not very, I don't know, they're not allowed, right? Unless an individual state is going to allow it. So we'll see how that changes, and the labeling and everything like that has to change for intoxicating hemp products, the Delta 8s, the Delta 10s, even Delta 9 derived from hemp. And we're just going to have to see how that goes. I think a lot of trends are going towards GMP once again, which has been happening for years, more and more states are starting to require that. Like Colorado is a perfect example. They allow intoxicating cannabinoids to be, registered in their state. They just don't allow it to be sold at storefronts in Colorado, but you can make the products and sell them online or sell them in different states. But you have to have GMP certification either in order just to get the registration. And that is a new development on July 1st. And so a lot of people are coming to that, oh my gosh, wait a minute, we didn't realize we had to be compliant with this. And it doesn't spell out very well in the regulations that you need certification, but it definitely, that's what you need. So it's really interesting the way that they're handling things. And I think that based on the way that other states are doing things and, allowing certain things in certain ways, I feel like being compliant with GMP standards is once again going to be required for most of these companies. And it's just kind of the way that the world is going, right? I mean, there are whole states that for THC cannabis and hemp, New York, for instance, and Florida and, Maryland and certain parts of Michigan and, all of the, so it's just kind of a rolling trend. And it's not a trend in just the cannabis space. I think people are like, well, why do we need this in just our space? And it's like, no, every wholesale food manufacturer has GMP certification.
Right.
Like this is not a new thing. We're not reinventing the wheel. Obviously cannabis has its own nuances and things that are very different than like a wholesale food manufacturer, but they have cannabis specific GMP certifications now. So, it's just a matter of getting it all done and figuring it all out and waiting to see what is going to happen. But like I said, most of our clients in the CBD or cannabinoid space, because we do have intoxicating cannabinoid companies that have GMP certification right now, which is really awesome. They're prepared, right? They're ready. And then if somebody does come in, they can be like, hey, this is what we have from an accredited third party. This is our consultant, and give a raw card and we can talk to them if we need to. So that's kind of the way that it's going. And so we're trying to help as many people realize what they need to do to get into compliance. And then hopefully they do,
Yeah, it makes a lot of sense. And this is why Qredible has really been heads down working on continuing to advance our quality management system, because I think the technology really, I know the technology plays a key role in implementing and following those good manufacturing practices. And because it really provides a systematic approach and a structured framework to making sure that these things are sort of embedded in action in the actual process in all aspects of production and quality control. And, so you can have a bunch of standard operating procedures that says we do this, we do that, we do this, we do that. But how do you actually make sure and govern that the training is there, right? So that the documentation and control and that are essential to maintaining these up-to-date standards that are actually being put into a continuous improvement process that aligns with these with the GMP focus. Because to me, it's like every business has to manage risk, right? And quality risk management is a key component of a quality management system and program. So it really helps to identify and mitigate those potential risks that, quite frankly, could affect product quality, safety, and efficacy, or in not doing that, leading to all those other things, lawsuits and people getting sick and reputational harm and all the things that you don't, and all the love letters from the government and the fines, fees, and penalties.
Yeah, the cease and desists are pretty crazy right now. Yeah.
Yeah, and we're seeing and that's the thing that, Kim, it's like you've been out there, this voice in the wilderness in this industry, and some folks are listening, some folks are preparing themselves, and others are like taking this wait and see approach. And I always believe that it's better to be in the business of fire prevention, right, than firefighting, because because sometimes it's going to be too late. You might not be able to put out that fire. So it really puts a new emphasis on having the right technologies to drive these things for training and competency and change control. Like, how do you know a employee is properly trained on these procedures? Well,
Mhm.
you got to test them through the system. You got to validate on a periodic basis that they understand what's going on. And when these regulations are changing, that they're being tested on the new changes. So they're
Mhm.
getting certified. And then you're putting in what I call the preventive, the fire prevention, techniques in there to incorporate this into sort of your process. And you're then modifying. It's like a continuous loop, and then you're modifying and improving your processes. So through that quality assurance and control process, you can see what's meeting the standards, what's sort of falling short, and where do we need to, make the changes. So to me, it's like the best insurance policy for making sure that your business stays intact. So you're doing the important work of helping them to prepare for this, getting
Mhm.
them into that that sort of that mindset and framework, and we're doing the work of making sure that what you're telling them is actually happening,
Yep. The
in process,
implementation side. Yeah.
the
Yeah.
implementation.
Well,
So
and long-term, compliance with it, right? So,
yes,
we're very project-based. We have clients that we've worked with for, 5 years that just have us on a 5-hour a month retainer because they want someone to be able to call and, do regular third-party audits with, which is like a really great tool. But for the most part, we come in, we have a project, we get it done, right? And then
yes,
we leave. And so, we get things done a lot faster than internally. We know what we're doing. We've done hundreds of these, types of projects. And so we just put everything in place. And then it's on the onus of the company to keep that going. I mean, they can call us if they need something. And like I said, many times they'll have us come back for an audit before their next accredited audit, but they're having something in place like a technology like yours, making sure that every day that they're following that kind of thing and keeping
yes,
all their documentation in one place and making sure that people don't lose things. I mean, I've had companies that are really small that have everything on paper. It's like when they start to get busy and expand, it becomes a real issue because not everybody is doing the same thing or following the same, guidelines. And it's just, it turns into a mess. So having, somewhere where everybody knows where it goes, everybody knows what they're doing, that's, always good for us for
And,
sure. So,
and and Kim, I've seen big companies that when I've asked about their standard operating procedures, they grab the binder off and blow the dust off of it.
yeah.
Like, oh
Yeah.
goodness, okay. Oh yeah, we've got them. They're all in here, and so I think that's no longer adequate, right? Because
Yeah.
especially in an environment that is going to be continuing to be changing dynamically, relative to state rules, relative to federal rules, whether the guidelines and best practices, and all of that has to be taken into consideration. That's why the comment you made about sort of folks that come back to you. And I think that's important because I've always told my business attorneys that I've worked closely with on all my businesses. I said, they said, well, what do you think about AI? Is it going to like take the place of, a lot of legal work? And I said, well,
Mhm.
one thing I can tell you is that AI won't replace, it cannot replace the empathy and the understanding, because consultants like you and attorneys like them, you're almost like a psychologist, partly because, business owners, they have these concerns, they have these fears. If they're really focused on quality, if they're really focused on risk management and doing the right thing, sometimes you have to talk these things out, right? It's not just about,
Mhm.
putting them in, but it's like, hey, am I doing this right? Am I getting this
Right.
right? What can you help me with this new thing that we need to put in place? Are we doing too much? Are we doing too little? And I think
Yeah.
that's really the importance of having, a consultant alongside of the technology, because
Yeah.
technology can't automate the empathy part of this. It can't automate what I call the psychology, which we all get concerned about as business owners, or you should be
Right.
concerned about as business
Well,
owners.
and with AI, it doesn't have a this then that feature, right?
Yeah,
So you can
yeah,
say, "Hey, write me a template for GMP or whatever," and it will write you a very basic template that I found is usually wrong, unfortunately. but because it's taking stuff from internet. And what we do, I mean, we don't sell templates, and this is the reason why we don't sell templates. It's the same as why AI can't do it very well, is because everything in GMP is very specific to your particular facility and very specific to the accredited certifying body. Every accredited certifying body requires something different, and they require different verbiage, right? And so what we do is we go, okay, this is the accredited certifying body you want to use, and this is all the different things in your facility, because not one process is the same. Now, everybody does everything completely different. They're making completely different tinctures and chocolates and suppositories and, you know, everything. So it's so specific to that facility that it would be impossible for an AI to write them the way that they need to be written. I actually was like stoked about AI because of this, because I was like, oh, could we just do audits? Because, you know, obviously an AI can't do an audit. But, you know, I was like, maybe this will make it easier for everyone. And of course, I did extensive research and did ChatGPT forever. And, you know, every single time it came out, I was just like really terrible. And I was like, okay, not quite there yet. You know, maybe in like 10 years or 20 years or, you know, whatever, or maybe never, because of that you know, being specific. It might not work out. But, you know, the general overview is, you know, can be there. I don't know. AI is interesting. I love AI. I think it's a very cool thing.
Yeah, I do as well, but it can't be, it's got to be used appropriately and can't be used as a full replacement. And I think that's the important.
You
that's
need
why,
someone's eyes on it. Yeah.
Absolutely. And you need the expertise and the experience, which is where you come in. So if somebody wants to allay their fears about all of this stuff, right? See, I keep doing that. Maybe it's great marketing.
If you run into an issue or something changes, I mean, you know, the other thing is, it's like when we go into a facility, right, we have seen a whole lot of things. And so usually with GMP, they're very strict about like, okay, this hand sink has to be in this area. And we've learned all the tips and tricks of like, okay, if you can't have a hand sink in there, what are the other things you can do to put in place? This is just like an example, right? As the hand sink. I feel like we run into hand sink issues all the time. And it's like, oh no, we've seen people that can do this. We just have to write an SOP for a variance, right? Walking through doors without touching hands, you know, foot kicks, you know, whatever we need, or a, you know, a temporary sink that we move in and move out and sanitize in between, or, you know, those are the things that like, that an auditor does, is like, oh, yeah, we've been doing this for a really long time, and we've seen this in 40 different facilities. We've been in thousands of different facilities. So it's just, you know, those kinds of things are really where I think our strength is. And you're right. We have a lot of compassion and empathy. We actually love this industry so much, and we love the people in it. And we really want them to thrive, right? Their success is tied to our success. So why wouldn't we? And that, you know, that's what's great, is it's a lot of times people think, oh no, we are so close to GMP. I think we have all these SOPs, we have a really clean facility. And then we come in and we give them, you know, we do just a gap analysis. And I think a lot of times they're shocked, because I think they think GMP is one thing and it's really not that thing. Right. So they're like, oh, we just thought, you know, being clean and did it. Well, no, there's a lot of like really, really specific guidelines about a lot of different things. You have to have 40 something different SOPs, and some of those are 70 pages long. You know, that's not something that you want to pay an internal person to write, because if one thing is off, then your food safety plan is screwed, right?
Absolutely.
And then people are getting sick. You know, you need someone who's like a certified professional in food safety to be there. You need someone who's a certified quality auditor to do the audit. And that's just the reality of where it is. And I think that it's very interesting when we see that in companies, because they, you know, go in really confident. Oh, we are so close. We just need help getting across the finish line. And then we get in there a lot of times and it's like, you have 30 SOPs that are non-existent, right? Non-existent in your facility, and you don't have one hand sink in your facility, or, you know, your floors are like need redone, or plumbing needs to be changed, or you don't have hot water, which is a huge violation for FDA. That'll get you shut down immediately. So weird things like that, you know, people just don't know what they don't know. And so it's really nice to go in and be like, okay, here are all of the issues. Here's your huge long list of violations. But you know what? This is okay. And this is typical. In this industry, it's typical that they aren't compliant. And guess what? Now you have a checklist and we can tell you exactly how to get into compliance with these things. And it is a huge relief to them to just be like, okay, we at least have a picture of what it is that's wrong. And now we understand GMP a whole lot better. And now we can actually tackle this issue instead of just like, because we don't know, just ignoring it. Right. And that's like what is, I don't know, it's just so rewarding to be able to go in and have a company go from here to here. Right. And where they're like not confident, they really don't know what they're doing. And it's hard for them and it's scary. Right. You lose sleep at night because of that.
Yes, very much so. And that's really what makes you one of the best in the industry. I'm a big fan, continue to be a big fan. And how do people get in touch with you and Allay Consulting to get some of this great work done?
Yeah, so you can go to our website at www.allayconsulting.com. And then you can always check me out on LinkedIn, Kim Stuck, certified professional of food safety on there. And you can always reach out directly to my email if you want, kim.stuck, STUCK, @allay, ALLAY consulting.com.
And didn't you get some recent badass award or something that named you one of the top, or what was that award you just got?
Oh, it wasn't an award, but I got on the list of like the top ladies in the cannabis industry. Yeah.
Well, that should be celebrated. That's all. That means, you're really good at what you do. So
yeah, well, thank you.
And you're humble. So that's why I brought it up. So
oh, thank you.
Well, Kim, always great to have you. You are one of the top in the industry, and you're doing great things, and more to come. And it's always great working with you and having you on the show. So thanks for joining us again.
Yeah, of course, anytime.
All right, take care.